So who am I? I'm a pharmacist independent prescriber. Sadly, no, I can't give you any codeine at the moment. And sadly, no, I don't want to look at the rash you got from Thailand. I'm sure they were very nice and good company, but no, that needs professional help. I am a Star Wars nerd. I do, probably guessed already, I do have a weird sense of humour. Just go with it. I'm also very old, and I remember MS-DOS that they gave out on it's a magazine. It was like, oh my God. So, disclaimer, all the information here is over 10 years old. I had previous permission from the owner. He's since sold. And would I lie about that? Hopefully not. If anyone watching the recording is at home is employed by Proscript, then skip to the end. This is very old information, and my name is not Darren Lewis, it's something else. And no patients were harmed, possibly inconvenienced, in the making of this PowerPoint presentation. So, when you log in I'm dealing mainly with Proscript. There are a couple of number systems. This is the one I'm more familiar with. I've used it for probably about 2 decades now. We have a small problem when you log in. You need a username and a password. This is audience participation now, and it's like, oh no one said anything about that. I'm just here to listen to talks. Don't pick on me. Would anyone hazard a guess of what the username and the passwords could be? Proscript, that's a good one. Admin. Just blank, yeah. Well, I'm really sorry. I'm also a practical joker because I played a trick on you. So you don't actually need a password, because if you go and use that file called PS Global, and where it says require a login yes, you just change it to a no. Whoops. And we're in. So what? So there's not much to do or see. If you know the person's name, you can access their records, but they need to have been to your pharmacy, been to the place initially. So you can't look up Kim Kardashian to see if she really did have any Botox on the NHS. You can't look at any of that kind of stuff. And Ivor Biggin doesn't work. I think the most exciting one we had was Pizza Hut, which this is a pizza-themed talk. And that's it. That's the end of the talk. So thanks very much for attending. Thank you. That was good, wasn't it? Hang on. I signed up for 1/4 hour. Good. So let's have a look at the file structure. So most of the stuff it's built on DBF files, which I think is basically just glorified database file. And each one has a corresponding CDX file. Edit the DBF file at your peril. I mean, I'm just saying, just for argument's sake, that if you edit the DBF file and don't do anything with the CDX file, it may cause the system to crash. Backups are your friend. I haven't tried this much. As we can see, most of the stuff is you've got databases of doctors, dosages, side effects, flavours, drug alerts, illnesses, the whole works. So from this file structure, the most exciting one there is table PMR, which basically is every single prescription that pharmacy has dispensed. So the one I was working at has dispensed 181,689 entries. Christ, no wonder I look blooming tired all the time doing all those work. And then you've got a patient one. This one's got every single patient ever entered onto the records. In this case, there's just under 9,000. And that's got names, addresses, phone numbers, date of births, all the kind of stuff. The program I used was DBF File Viewer. You can export it to good old Excel. I mean, who doesn't use and love Excel. So I've got some real-world examples. So these are, back in 2006, we dispensed 56 Don-11, which is donepezil for Alzheimer's. You've got 30 Des-13s, which is desloratadine antihistamine. So you can get a little bit of information, but you need to cross-reference each database. So the number is basically the patient number, date, obvious, drug, the drug code. Doctor Doctor 8 would be a GP in the pool area, one of the local ones. You can normally tell the lower the number, the more likely they are to be fairly close by. There's a type, which I haven't got on that form because most of them were blank, most of them are NHS. There's a P if it's private. And exemption status. Now, as I've said before, this information is old. So we've got A, B, C, D, F. There's an E in there as well. That's all been simplified. But essentially, C is your over 60s. D is maternity. So in our example from 2006, same person, and they've had all that, and they're over 60. So it's quite useful. Except I've just put, what use is that? So you need to use multiple database files to cross-reference. So if you want the patient number, you've got to look at the DBL patient. If you want the drugs, it's England, because that's all the English drugs. There's doctors, and the exemptions look on the back of a prescription. Some of these files are edited and updated every month. So if I were to change 5 drugs in the England database next month, I'd have to do exactly the same because it's updated remotely. Other DBFs can be edited, lines deleted, which is fairly pointless. So if we took our previous example, if we deleted some entries from 2006, all we're doing is just deleting an entry. They've still had the drugs. I've still been paid for them. Thanks very much. But, deleting a donepezil, what's the point? Fairly little. So these are real-life examples now. This is where pharmacists go bad. Sounds like a very bad Sky One documentary, doesn't it? So patient 11368, under 16, using the drug code MIC41. Using the England database, you can figure out that MIC41 is microgynon, which is used for period control contraception. Has she told her parents? If she's under 16, as long as she's Fraser and Gillick competent and has mental capacity, she doesn't have to. If she's mature enough to make her own decisions, which is just ripe for blackmail, which is a bit wrong. But then I've put on there, it's like, it is blackmail material, but how much money would a 14-year-old actually have? So you look at return on investment, you're not getting very much at all. Although you could actually bribe her for some other things, like, need access to your father's Maserati, and just take that for a joyride. Example number 2, this is patient 781. He is over 60. He's using SIL-42, which is sildenafil. It's used for hydraulic maintenance. I know, it's a performance issue. 2 types of men. There are the men that go, have you got any Viagra? And there's the other type of man that's like, I want the 100 milligram, I want to hammer nails in. It's sad, it's true. Does his wife know? I've actually had a case where a wife came in to pick up her medication and was given the husband's medication, of which he was not using it with her. Whoops. They were soon divorced. And now instead of a nice big mansion, there's 2 smaller little bedsits they both sleep in. So, all right, keep touching that. This is going to have a much better payout than the last person. They're going to be more established. They're going to be wealthy. You can just milk them for anything you can, if you're that way inclined. These are my favourites now, you see, because I don't do blackmail. It's a lot of hassle, a lot of problems. You need to keep track of how much you're, asking for. So you can change the PS Global INI entries, because that's not updated. So we've got emergency supply text equals emergency supply, password wholesaler screen equals no, and no dose text is users directed by the prescriber. So these are just some of mine. I've not done this just for the benefit of the recording. So the emergency supply one, to say, you can change it to you're a fucktard who needs to order earlier. Especially Christmas people. Seriously, don't make my life harder. Wholesaler screen, let's just change that to yes. Then no one can order anything. Whoops. And users directed by the prescriber to be used rectally with no lube. And that would go on every single one you print with no label, with no directions. You can see why they're my favourites, can't you? So it's not all gloom and doom. It's not all blackmail. So ProScript has evolved, which is good. Each pharmacy now uses a separate login password. They've moved to MySQL or SQL. Let's see if we can divide the room 50-50 by pronouncing it incorrectly. All the information is now 10 years old, at least. I mean, you've seen 2006. The contraceptive patient's now 26. And the Viagra patient, sadly, was born in 1922. So, God rest his soul. He had fun on the way out. He hammered those nails in, literally. On the outside as well, which is actually quite impressive. Any questions? Is this... And now I'm not going to talk about the rash. And that's it. Thank you for listening.
Thanks, Darren. Any questions? We've got time for 2. So who'd like to go first? You don't have to ask a question if you don't want to.
No one, thank you.
Oh, got someone over there.
So it's good to hear that they've improved things to some degree. So do they actually encrypt all this data in the database now?
Yes. So most of it now is off-site. So the legacy stuff from, I think, 2011 is still, you can download it. But, I mean, it's chunky files and it's not really relevant. I mean, anything that somebody had 20 years ago, things have moved on. Either it's dropped off or got better. So, but most of it now is SQL encrypted, remote server, remote backups, passwords are changed. This is quite an interesting, fun remnant.
Well, it's an interesting thing with old data because for chronic conditions it would still be relevant, probably.
Some of it, yes.
Thank you. Hi. It's a very interesting presentation.
Thank you.
My question is this kind of medical record system, would it actually be linked to medical devices in a hospital setting?
So this one wouldn't be, because each pharmacy has their own separate system. So if I worked for Boots or Roland's or Superdrug, they're not linked. So I could take my Viagra prescription into 4 different pharmacies and they wouldn't know I'm getting Viagra. So it's not linked yet. The GP systems are linked and they've got far better security. They're all remote access. And a big disclaimer comes up with misuse of Computer Act, which I don't want to get fired.
Thank you, Darren. Round of applause. Oh.